On August 15th, 2013, I'd received some terrible news. My father-in-law was in the emergency room and he had just had a stroke. As an ICU nurse, I instantly understood the gravity of his condition. Strokes are medical emergencies and they are the leading cause of death here in the United States. Every 40 seconds, somebody will have a stroke, and every 4 minutes, someone will die from a stroke. Strokes have not only affected me personally, but I've been a nurse for 9 years and I have worked primarily in neuro, taking care of many stroke patients. So today I would like to take your time and inform you more about strokes, including what they are, signs and symptoms, how to prevent them, and I would also like to clarify any myths that some of you may have regarding strokes. Let's begin by talking about what a stroke is. So what is a stroke? A stroke is when blood supply to the brain is blocked and it deprives the brain of vital oxygen. This causes brain cells to die, and often loss of brain function will result. There are two types of strokes, ischemic and hemorrhagic. Ischemic strokes are the most common. This is where blood flow to the brain is blocked and most likely due to a blood clot. The other type is hemorrhagic. This is when a blood vessel in the brain bursts and causes bleeding into the surrounding brain tissue. Although these are not as common, these are the most deadly, and this is the kind that Ray had when he was first admitted to the hospital. Some have heard of the term mini stroke or TIA. These are called transient ischemic attacks, and although the symptoms often go away within 5 minutes, they are still very dangerous because that's a sign that the person will most likely have an actual stroke in the near future. So what are the signs and symptoms of stroke? A way to remember these is by the acronym BFAST. B stands for balance. You may notice that their balance is off. They may have loss of coordination, or they may complain of feeling dizzy. E is eyes. They may have trouble seeing. They may have blurred vision or loss of vision. F is for face. Their face may be crooked. You may notice that their smile is off, or one side of their mouth is drooping. A is for arms. They may have weakness or numbness on either one side of their arms or legs. You can test this by having them hold their arms out in front of them, and you may notice that one of their arms starts to droop. S is for speech. They may be slurring their words. They may be unable to talk, or they may appear confused in general. And the most important one, I feel, is time. If you notice that they have any of these symptoms, it's important that you call 911 immediately. Time is of the utmost importance, especially when it comes to strokes, as there are many treatment options available, but they are very time sensitive. Another symptom that I would like to go over that is not part of the BFAST is headache. They may be complaining of a severe headache, or you may hear them say that they're having the worst headache that they've ever had. So although strokes are life-threatening, the good news is that they are preventable. Actually, 8 out of every 10 strokes that occur are preventable, so it's important to maintain a healthy lifestyle. Research shows that those who maintain a healthy lifestyle actually have 80% less chance of having a stroke than those who do not. So how do you prevent a stroke? Here are some ways. If you currently smoke, quit. Smoking, including secondhand smoke, damages and tightens blood vessels, which therefore will increase your chance of having a stroke. Get moving, increase your physical activity. This is important for your health in general. It's important to try to get at least 30 minutes of moderate physical activity daily. This can include running, swimming, jogging, or even brisk walking. Eat a well-balanced diet and aim for a healthy weight. It's important to avoid foods that are high in fat, like fried foods, and also avoid foods that are high in salt content, like processed foods. Actually, processed foods and meats can contribute to heart disease, which will also increase your risk of having a stroke. Lower your stress levels, get adequate sleep. There are different techniques available to manage your stress levels, such as meditation and yoga. Also, know your risk factors. For instance, high blood pressure. High blood pressure is the most important independent risk factor for having a stroke. High blood pressure can weaken your blood vessels. Just think of it like a rubber band. If you're constantly stretching a rubber band, it eventually will weaken and can burst. So let's review and clarify some myths that some people may have regarding strokes. The first one is that many people think that strokes only occur in the elderly population. Unfortunately, strokes do not discriminate on age, race, or ethnicity. According to the National Stroke Association, children can also suffer from strokes. Matter of fact, stroke is one of the top 10 causes of death amongst children. I also want to say that 15% of ischemic strokes occur in the young adult population. This is very dangerous because young adults often are not aware of the signs and symptoms of a stroke. So if they have the symptoms, they may ignore them. The other myth is that there is no way to prevent a stroke. As I previously discussed, 80% of strokes are preventable. The next myth is that strokes are not hereditary. Actually, they are. Having a family history of stroke does increase your chances. That's why it's important to follow the guidelines that I mentioned before about maintaining a healthy lifestyle. The next myth is that if somebody has a stroke, they will not have another one. According to the Stroke Foundation, 4 out of 10 people who have a stroke will go on to have a second one within 10 years. So as I earlier had mentioned, my father-in-law, Ray, unfortunately, after 5 days of being in the hospital, Ray had a second massive stroke and passed away. Had his risk factors been better managed, it may have prevented his death. So nearly 800,000 Americans in the United States have a stroke every year. To put that into context, that's enough people to fill the AT&T Stadium 10 times. Like I said before, stroke is a leading cause of death amongst Americans. So it's important that we all become aware of not only our risk factors, but how to prevent them from happening in the first place. World Stroke Day is coming up in 2 weeks on October 29th. I hope that this information has increased your knowledge and has helped spread awareness about this detrimental medical condition. Thank you very much for taking the time to listen to me, and I hope you all have become better informed on strokes.